ईश्वर का दूजा रूप है वो, ईश्वर का दूजा रूप है वो। इस कोविड काल में अस्पताल को अपना घर बनाए ताकि हम अपने घरों में सुरक्षित रह सके। जी हाँ, हमारे डॉक्टर्स। फर्स्ट ऑफ ऑल, I would like to thank to Dr. Prerna Tiwari. She took our initiative and gave us time from her busy schedule. She had done her PhD, MBBS from KIMS Bangalore and MD Pathology from IMS BHU. Presently, she is working as a senior resident at AIIMS Patna. She will put emphasis on the coronavirus life cycle, effect on the human beings and prevention. Please put your warm welcome to Dr. Prerna Tiwari. Ma'am.
A very good morning to all of you. I am Dr. Prerna, working at AIIMS Patna. I am very privileged to have been invited to present my talk in this international webinar 2020 on COVID-19, Turn Challenges into Opportunity, organized by SM College, Bhagalpur. I shall be speaking on my topic, coronavirus, its life cycle, effect on human body, and its prevention. So what is a virus? As we all know, in very simple terms, viruses are like germs. They are very small infectious particles that cannot survive on their own. They need a living body to survive as well as multiply. Coronavirus are a large family of viruses which have caused illness in the past also in the form of respiratory infection ranging from common cold to even SARS. SARS, as we know, the full form, severe acute respiratory syndrome. Now, coronavirus can cause illness in animals as well as in humans. The most recently discovered, as we all know, the pandemic in which we are living is COVID-19. The full form of COVID-19 stands for coronavirus disease in 2019. Why has it been named so? Because this COVID-19 virus was detected in 2019 in December in Wuhan city of China. So the causative agent of COVID-19 is SARS coronavirus. Now coming to the life cycle and the mode of spread of coronavirus. As you all know, and on the TV and all media, even the health ministry, the local authorities, all of them have been constantly telling us the modes of the spread of the virus and how can we prevent it. Initially, coming back to China, bats were thought to be the original source of COVID-19. Humans have contracted it from bats, and now, as we all know, it can very well spread from humans to humans. The disease can spread from person to person through small droplets from nose and or mouth. When a COVID-19 positive patient exhales or sneezes or coughs, these droplets, they then land on the objects and surfaces around the COVID positive persons. Point to be noted here is that they remain there on these objects as well as surfaces for several hours to days. So other normal people can catch hold of this COVID-19 virus by touching these objects and surfaces, and then again touching their eyes, nose, and mouth with the same hands. One can also catch these infected air droplets if they continue to be present in the vicinity of a COVID-19 positive patient. That is why it is important to stay more than at least a meter, which is 3 feet away from the person. In fact, these days, some studies also suggest that the air droplets of this virus can travel to 2 meters, which is 6 feet. So basically, a distance of 1 meter to 2 meters should be good enough. Now, what happens to the virus when it enters the body? So after the virus enters the body, its period of incubation. So what is a period of incubation? it is the time from contracting the virus to occurrence of symptoms. And this incubation period ranges from a minimum of 1 day to a maximum of 14 days. That is why the health ministry had made the guidelines for quarantine or isolation for at least a period of 14 days. Now, on entering the body, the virus goes into the upper respiratory tract. So by upper respiratory tract, I mean the nose, the pharynx, and the upper part of the trachea, which is our windpipe. So if the person has a very good immunity, he can very well contain the virus in the upper respiratory tract only, and the symptoms that he can present could be just cough, sore throat, I mean very mild symptoms. Or even if the immunity of the person is very high, he can even be asymptomatic. That is, he might not show any symptoms, even if he is positive. But if the person has low immunity or also has underlying comorbid conditions like diabetes, like high blood pressure, then the virus can travel lower down to the lower respiratory tract. That is, it can infect the lungs, and the patient can then have breathing difficulty, pneumonia, and even resulting death of the patient. So, talking about the symptoms of COVID-19, as we all know, the most common symptoms of COVID-19 are fever, tiredness, and dry cough. Remember, the cough is dry. It is not productive, as is the case with pulmonary tuberculosis. Patients can also present with body pain, with nasal congestion, with sore throat, and even with GI symptoms, that is diarrhea. Newly added symptoms as per the government guidelines for COVID-19 are loss of smell, which is anosmia, that we cannot smell around us, and loss of taste, which is ageusia. Most of the people get infected, but they don't feel sick. That is, they are asymptomatic. Still, they are potential carriers and they can still spread the disease. Around 80% of the infective persons have recovered from the disease without needing special treatment. Around 1 in every 6 people who are COVID positive become seriously ill and they develop breathing difficulties. Older people, pregnant women, children less than 12 years of age, and as I already told you, people with comorbidities like suffering from kidney infections, any cancer, high BP, diabetes, they are likely to develop serious illness. Now, people with cough, fever, or difficulty should immediately report to the nearest local medical authority and should seek medical attention at once. Now, the most important part, how do we prevent ourselves from catching COVID-19? Well, it is not a very tough task. It is a very easy task. If we follow simple measures from our side to prevent the COVID-19, we can prevent the COVID-19 transmission. The first and the foremost thing that we should be doing is regularly and thoroughly cleaning and washing our hands with simple soap and water. By simple soap and water, I mean probably a disinfectant soap like a Dettol or a Savlon, which is very essential. And this hand washing should be done for a minimum of 40 to 50 seconds. So we have 7 steps for hand washing. So the 7 steps of hand washing, I will be going to demonstrate. If you can see my hands. Can you all see my hands?
Yes, ma'am.
Okay, fine. So first we need to wet both of our hands. Take adequate amount of soap in soap or soap solution in one hand. Then rub it in both the palms. Then between our fingers. Then at the back of the palm like this. And then separately for both the thumb. It should be done like this. Then finger. So finger 5 times clockwise, 5 times anti-clockwise. Similarly, for the other hand,
हम लोग
5
ऐसे नहीं
times
धोते हैं
clockwise, fly 5 times anti-clockwise, then wash
ऐसे
that put soap till the wrist, and then finally wash your hand and pat dry. So these are the 7 steps which should be followed, especially in this COVID era, for telling that, okay, we have washed our hands properly. Now, if you do not have soap and water near you, then only use sanitizer or hand rub. So a sanitizer that you are using should be containing at least 70% alcohol, and that should also be done with these 7 steps. ऐसा नहीं किया कि बस हाथ में लिया और धुल लिया और पोंछ लिया, बिल्कुल नहीं. अगर हम सैनिटाइजर भी यूज कर रहे हैं तो इस तरह से वो 7 स्टेप्स कंप्लीट करें कि एंड में हमारा दोनों हाथ पार्टली ड्राई और पार्टली वेट होना चाहिए, एंड शुड लीव द हैंड्स लाइक दिस सो दैट दे आर ड्राई. सैनिटाइजर को कभी भी किसी भी टॉवल से रब नहीं करना है, उसको ऐसे ही ड्राई रखना है. So first important thing is usage of soap and water. If you don't have soap and water, then only use sanitizers, because frequent use of sanitizers are causing severe skin reactions like contact dermatitis. Okay, so this was the first step in prevention, the most important one. Now the second one, as the government has issued guidelines, wearing mask in public places would also curtail the transmission of COVID-19. Now, at least we should make, like I already told you, since the virus and the air droplets of the virus have been thought to travel a minimum of 1 meter, so we should always maintain social distancing at least 3 feet or 1 meter. If you can maintain more, well enough. We should strictly avoid touching our eyes, nose, and mouth. Even if you have washed it, it is fine, but touch only when important. You should not touch. Refrain from touching. Now, good respiratory hygiene is very important. What is good respiratory hygiene? Now, when you are sneezing or coughing, please do not use your hands to cover your mouth and nose. Use the bend of the elbow like this if you do not have a tissue paper. If you have a tissue paper, wipe it and throw it in the dustbin. Do not throw it here and there. Best part is use the bend of your elbow like this. Okay, this is very important. Now, you should, in fact, we all should stay at home if we feel unwell. In case of any fever, cough, or breathing difficulty, we should seek medical advice and follow the directions of the local health authority. Now, we should avoid traveling, especially to the COVID hotspot areas. Travel unless and until, do not travel unless and until it is very essential. So to conclude my talk, I would like to say that if we have to fight and win over this COVID-19 pandemic, we should not panic. But if we follow these simple measures, we can break the chain of COVID-19 transmission. COVID-19 does not discriminate on the basis of gender, economic and social status of a person, his caste, color, or religion. Then why should we? Let's all stand united and fight against COVID-19. Let's each one of us become COVID warriors. Jai Hind. Thank you.
Thank you, Dr. Prerna. Your wordings was really valuable words and mean for us. Now, I would like to proceed the session via Dr. S.K. Suman from Home Nutrition Department, SM College.